Good morning, everyone. I'm recording this video while driving pretty slowly, so safety is not an issue at this time. Thank you. Just wanted to let you know that I'm not taking things for granted. I wanted to record this video because I have been concerned, really concerned about the rash of deaths that I have observed, heard about through the news, through social media. The deaths of young men, not so young men, from heart attacks, from strokes, from sudden death, from arrhythmias. It's been really unprecedented. Now, I don't know whether we're hearing about them more now because we're now all on social media more and more since the onset of COVID, and I'm not going to get into any theories as to why they are happening because I am all about solutions. Now, I'm going to give a disclaimer before I go further. I am a doctor, as people know. I am a doctor. I've been practicing medicine for over 30 years, and I can honestly tell you that I have not seen this degree of reports about the incidents that I mentioned a few minutes ago. I've never seen it in my whole career, as the whole length of my career as a physician. So my disclaimer is this: I am not your doctor. I do not know your history. I don't know your family history. I don't know your mental health history. I don't know your medical history. And this is not in any way to serve as medical advice, but I will give you one thing that you can do and one thing that you can ask your doctor about, and that is very simple. This is not a gimmick. I'm not going to ask you to contact me. As a matter of fact, I don't want people who let's leave that alone. But the one thing I will have you do, actually one major thing in terms of medication, so simple, it helps to prevent other diseases and other things that I will mention. The number one thing is this: take a baby aspirin every day. If you are male, especially over the age of 50, if you are an athlete and you don't have any bleeding issues and you have cleared it, again, I am telling everybody that I am speaking to right now, who's listening to the sound of my voice right now, once you have cleared it with your own primary physician, I would like you to consider taking a baby aspirin a day. It may be life-saving for you. Why do I say that? Aspirin is, in layman's term, a blood thinner. And it is one of the treatments that have been used and utilized for many years in the treatment of blood clots and in the prevention of blood clots mostly. Some people have had to use it because they're dealing with autoimmune diseases, people who have had difficulty getting pregnant because, autoimmune diseases sometimes tend to cause excessive clotting, which can kill off the early embryo in the early stages of development. So aspirin is used in that instance as well because it is a blood thinner. Taking an aspirin a day may help keep your blood just thin enough to prevent a stroke. May help you get your blood just thin enough to prevent a heart attack. May get your blood just thin enough to prevent other cardiovascular and cerebrovascular events if your heart is beating irregularly or is not beating as it should. Again, nothing can substitute for personalized care from your physician. So please talk to your physician and ask them if taking aspirin is an option for you. It may be life-saving. I'm doing this because I am really concerned. It is not based on sensationalism. It is not based on any kind of conspiracy theory or the other. One of my theories is that because of the shutdown with COVID, a lot of us have become less active than we normally are. and that gives rise to a whole bunch of other medical problems. So I'm not talking about some sort of conspiracy theory here. I'm talking about saving lives. I'm talking about saving a life, maybe yours. A baby aspirin a day after clearing it with your physician. The other things that I would like to mention is this. A lot of people have gotten into this habit of eating processed foods a lot of processed foods. Get away from eating processed foods. Cook your food every day.